Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Welcome, everybody. We are so happy that you've all joined us. Today we're talking about something that we don't often talk about, and that is partners in the family of pregnant people. To be honest, we really do not do a very good job of supporting partners. So Sarah and I today are going to be chatting a little bit about postpartum depression in our partners. So Sarah, why don't you get us started?
I sure would love to, Alicia, and I totally agree. It's something that we don't talk about often enough. And it's really important to recognize that postpartum is a time of change for all family members. And we really rely so heavily on our supports during this time. And it's really important to think that if our partner's suffering from mental health concerns, it's so important to discuss it with them and then support them to get help. Like you mentioned today in this podcast, we're using the term partner. But unfortunately, there's not a lot of data on same-sex partners, but many of the same stressors are present. However, it's important to just acknowledge and mention that most of the studies are on postpartum men, but we will refer to partners. So let's start by talking about what we actually mean by partner postpartum depression. And so just understanding that the rate of postpartum depression in men is about 8 to 10%. It generally tends to peak at about 3 to 6 months postpartum, but it can actually develop sort of slowly over the course of the first year.
There are certain factors that we see as increasing the risk of being affected by partner postpartum depression, and these include 1, a history of depression, 2, marital discord or challenges within the marriage, 3, poverty, 4, maternal depression, so depression of the gestating parent, 5, unintended pregnancy, 6, sleep deprivation, and frankly, who doesn't have sleep deprivation at this point? And along with that kind of goes disrupted circadian rhythm. So this might apply to partners who are working shift work or those types of things as well. So as you can imagine, these issues in part can be present in many postpartum partners. As new norms are being established in the relationship, newborn sleep is disrupting restorative sleep patterns.
Well, it's just something interesting that we also know about men's hormones is that their levels actually shift during the pregnancy and in the first few months postpartum. And this is thought to actually improve the parent-child bond. We have no doubt that in female partners, there is likely a shift as well. We just don't have the data and the evidence to support that yet. But, looking at some of these shifts that we do see in male partners is decreased cortisol levels in pregnancy and early postpartum, which then shift back to normal within the first few months postpartum. And it's important to understand that cortisol has many important functions in our body related to metabolism, and it's also known to many as the stress hormone. So its return to normal levels in postpartum may create a sense of increased stress in the body. Another important thing to note is that we see a decreased testosterone and increased estrogen levels. And these are both thought to occur to improve bonding with the baby. But we also know that lower testosterone levels in men can contribute to lower mood.
I find it so fascinating when people are going through events together and their bodies just naturally
Yes.
sync up like that. The partner is not pregnant, yet their
Yeah.
hormonal shifts are preparing for this new baby to come and are there to help support this new baby and help support that bond. Like, I just find that so fascinating when we learn these types of things.
Right? I know. It's so cool.
Yeah. So we understand a little bit about who's at risk for kind of postpartum depression from a partner point of view and some of the hormonal changes that might be influencing that as well. But then we need to talk about what might that present. And more common symptoms of depression are sleeping too much or really struggling to fall asleep, a low mood. But in men, traditionally, some other symptoms of depression may also include like increased irritability, indecisiveness, or just a decreased range of an emotion. So less excitable, a bit more blunted. We might be seeing that. And the other reason that it's important to talk about this is I think there's a lot more stigma around mental health
Mhm.
in men than there is in
Yeah.
women. And there's all kinds of reasons for that. However, I think it's really challenging for partners to come forward to talk about their mental health concerns if they're having them because one of the stigma, but also I think a lot of partners see their role as to support the birthing parent. And so
Yeah.
they don't want to take away from that support by asking support for themselves. But I'm going to tell you a couple of little bits of information that hopefully might sway people to reach out for help a little bit more because I know for myself, my prime objective is to look out for the well-being of my children over and above myself. So this information is not meant to say you are going to cause this. This is meant to say this is a bigger issue than just you. For the well-being of yourself, for your well-being of your family, for the well-being of your kids, please seek out and get help if you are struggling. We know that parental depression affects our children. And with paternal depression, some studies have also shown an increase in hostility towards their children and a decrease in sensitivity when dealing with their children. There's also been some studies that have shown that children who live with a father with mental illness have a 33 to 70% chance greater than somebody who doesn't live with a father with mental illness of developing emotional or behavioral issues. And paternal, i.e., father, depression was associated with delays in behavioral, social, and emotional development in 4 to 5 year olds.
Yeah. It's so hugely impactful. I mean, it just goes to show why this is so important. And like you said already, Alicia, mental health is so stigmatized in our society. And, I think it's really important to recognize that often partners don't take care of themselves because they're focused on caring for the newborn, they're focused on caring for the birthing parent, or they may not want to admit they're suffering. And I think in our community in particular, it may be hard for that partner to access medical support. We have supports in place. We have midwifery, we have doulas, we have family practice obstetrics providers that are all there to focus on the newborn and the postpartum mom. And it may be more difficult for that partner to get help, but it's important to ask. And please know that this is common and there are ways to help. And if you don't know who to ask, you can ask your partner's care provider and just seek out support. Please, please ask for help.
Yeah. So if you are feeling like this, what are the next steps or what could be the next steps? First of all, I would talk to your partner. Let them know how you're feeling. Don't put any of the blame on them or the expectations for them to change or quote unquote fix it. That's not their responsibility. But I'm pretty sure that they want to know if you're suffering and what, if anything, they can do to help support you in your healing journey. So be vulnerable, be open so that they can really help support you in a way that works for you. Reach out to your care provider. There are many resources that can be accessed in different communities, including counseling, cognitive behavioral therapy, or even online supports. Talking to your friends, and you may be surprised to find out that you're not alone in these struggles. And sometimes just knowing that can be helpful and therapeutic in and of itself.
Yeah. And I think something important to talk about that we've talked about, when we talk about, postpartum depression in the birthing person is nests. So nests is actually an acronym. And it's important to understand that this can apply to the non-birthing parent as well. So we'll just take a few moments to review what this stands for and what these supports are that you can put in place to support and protect your mental health. And so the first letter N stands for nutrition. And so, really making sure you're eating healthy, regular meals and snacks because this is what sustains us and gives us our energy. And so, putting some effort and intention into that and also asking for help in that area, that's a really easy way. Lots of folks outside of your home can support you. E is for exercise, movement. This helps everyone. And, it would be really great for your mental health if you could actually re engage with something that you enjoyed doing before the baby arrives, because we know a lot of things go to the wayside once baby is born. And even better, if you have a friend to provide you some social support at the same time, it's like a complete added bonus. So we know it's a lot. It can seem like a lot to ask when you have a new baby. So even just trying to fit in 1 to 2 hours a week of time where you're moving your body can be incredibly helpful. And it's really important to talk to your partner about ways that you can do this and support this with one another during those first few hectic weeks to months postpartum. Another is S for sleep. We know babies don't really sleep in long stretches. So, how can their parents? Well, like Alicia said, we have a newborn sleep course that goes way into detail around this. And I wish that had been present before I had my first and second babies. A few important tips are that you can create a plan with your partner so you can both get at least a 3 to 4 hour chunk. Now, if you haven't had your baby yet, this may sound like not very much sleep, but with all the physiologic changes, if you get at least a 3 to 4 hour chunk and a few other short bursts of sleep, you'll feel significantly better than if you're just sleeping in sort of 30, 45, 60-minute, 1 to 2 hour increments. Another option for those who it's available to is to hire a postpartum night nurse or doula a few nights a week to support you. And like we mentioned again, we have a newborn sleep 101 course that will help you set expectations and support your baby to get better sleep, which will then help you get better sleep. The T in NEST stands for time for self. And this is so important. And again, there's a lot of guilt around putting ourselves first. It doesn't have to be a lot of time, but even taking just 15 to 20 minutes to reset yourself if you're struggling, frustrated, angry, or feeling sad can really help. So this might just be taking the time to phone a friend and debrief, to read a book, or go for a walk around the block. As long as your baby is safe, then you can absolutely take some time for yourself. Again, chat with your partner about what this might look like for both of you and how you can support each other in doing this. And then the last S is support. Reach out for help, whether it's your family doctor, your midwife, a counselor, a family member, a friend. Let people in and open up. No one can help you if they don't know that you're struggling.
And another thing that I think people forget about is that many workplaces actually have programs that can offer support to new parents, be that parental leave or counseling. So look into what options you might have access to or qualify for, or what kind of extended benefits you have that might cover that. Because again, oftentimes these things are private pay, and so finances can be an issue. Certainly, there's also in some communities lower pay options. So again, if you're struggling with finances, talk to your care provider, and they might be able to direct you in the right space to access some of those things if you are struggling with finances. So another option is medications. And now medications are one of the tools in a toolkit to help with these things. Nobody's going to start on medication and instantly feel better. That's not how it works. We need to have all of those other pieces of the puzzle already going. And any medications we try, we know it takes 4 to 6 weeks to really know if it's making an impact. So certainly if you are going the medication route, please recognize that it does take some time for those medications to kick in. So most people with mild to moderate depression will actually do well with the things that we just spoke about, but some people do need more support with medication. So if you are a breastfeeding partner, know that most medications of the SSRI category are safe in breastfeeding. So just let your provider know that you are breastfeeding or providing breast milk to your little one. If you're not providing breast milk to your little one, you do have a few more options out there. So there are many options to support mental health with medications, and sometimes it does take a few different tries to find the ones that work for you. A big concern for many people when starting an antidepressant or an anti-anxiety medication are questions around weight gain and sexual side effects. But please be rest assured that there are options out there that have low risk of both of those. So if you're concerned about either or both of those things, please let your prescribing provider know that you are.
So that is our short but sweet overview of postpartum partner depression. And really, we just wanted to highlight the fact that it exists in and of itself and, certain people that are at more risk of it. And so why don't we go through a few key takeaways from this podcast? Number one, it is common and you're not alone if you're experiencing this. For male partners, it generally peaks around 3 to 6 months postpartum. And it's really important to recognize both as the birthing person and as well as the partner that there's probably more stigma around partner mental health than there is for the birthing person, because we really started talking more about postpartum depression, but we really haven't started talking about this at all. And even though there is more stigma, if people don't know you're suffering, no one can support you. And like Alicia mentioned, there are many options for treatment, including counseling, group skills training, and online supports. We'll be sure to link some in the show notes. And many of the supports that we have in our perinatal mental health handout apply to all family members. So we'll make sure to link that as well. It's important to understand that medications can help if the other measures that you've tried haven't. And if you're concerned about any potential side effects, please mention these to your care provider so they can work with you to find the right match for you. Lastly, and this may be the most important thing, not just early on, but going through your whole parenting journey, is to have regular check ins with your partner. Find out what you both need from the other for support and make a plan to implement it. We recommend having a listen to our podcast on preparing your relationship for a newborn, and we'll be sure to post that in the show notes as well.
Thanks, everybody, for taking the time to listen to this very important but not very talked about topic. We hope you guys enjoy the rest of your day. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.